All right, so this is mine and Jordan's article discussion because we couldn't find someone to interview. So this is what we're rolling with. Okay. Kind of a cool little title slide there. Anyway, so Jordan and I did our discussion on the differences in running biomechanics between maximal, traditional, and minimal running shoe. A lot has been throughout class. We've kind of learned that like you'd expect someone with a minimal shoe to run with more of a mid-strike pattern, and how it kind of discourages overstriding, whereas maximal shoes, you would think intuitively leads to more of an overstriding mechanics. But this article kind of looked into exactly that. So while shoe companies have significantly changed their design in shoes, one thing that has remained constant is running related injuries. So even when running became very popular in the 20th century, significant changes have been made to the design and architecture of the shoe, though running related injuries have persisted nonetheless. So a lot of research has been performed on the biomechanical implications of maximalist versus minimalist shoes. There was that big boom of minimalist shoes after that one guy wrote that book. I forgot what it's called. Born to Run, I think. So previous studies looking at this have shown that Achilles tendon loads are lower when running in a maximal shoe, because that's kind of how that increased cushioning leads to more of a rear foot strike pattern. So it makes sense that you have less load in your Achilles. And then because of that, you kind of have this prolonged eversion in maximal shoes. So again, less demand on the plantar flexors, leading to less supination. Loading rate and impact peak tend to be higher in maximal shoes, but instantaneous loading rates are higher in minimal shoes. That's what previous studies have shown. Though there have been some disagreements due to lack of standardization between testing speeds, population, running surface, and shoe brands. So it's kind of hard to generalize. So the purpose of this study was to compare some of these biomechanical implications. So dorsiflexion, eversion kinematics, and ground reaction forces between maximal, traditional, and minimal shoes. So this study hypothesized that maximal minimal shoes would result in a greater average vertical loading rate and impact peak than the traditional shoe. These maximal shoes would also result in greater eversion duration and eversion angle at toe off than the minimal and traditional shoes. And then the maximal and minimal shoes would both result in greater plantar flexion at initial contact than the traditional shoe. So again, what I was getting at earlier is that previous studies, the complaint has been lack of standardization. So this study tried to control for that by using the same brand. So as far as methods go, they use New Balances, but the inclusion criteria to participate in the study, you had to be 18 to 45 years old, and you have to be a runner. So averaging at least 10 miles per week. So that's more than the 1 to 2 miles I run, if that, on every week. No major injuries in the past 6 months, and be considered a rear foot striker. And they did this not by a qualitative assessment, just by looking, they land with their rear foot like we do when analyzing gait, but by using a force plate and seeing if they had a distinct impact peak. Then they'd say, okay, these runners more of a rear foot striker. So just kind of a kinetic factor as opposed to kinematic. 21 reflective markers placed over various anatomical landmarks. So greater troch, medial and lateral malleolus, a whole bunch of lower quarter landmarks. And then all runners ran at a comfortable pace in a maximal, traditional, and minimal shoe. So the traditional shoe used was the New Balance Fresh Foam Boracay 980 V2. No kickbacks from this, just the design of the study. Though the other shoes were prototypes, they weren't available for commercial value. But they're the same shoe. They were just kind of the cushioning or the support changed. So these maximal minimal shoes use the same model but varied in cushioning height, and were custom designed for this study. So this shoe in the middle here was the only shoe that was available for commercial value, but these other two, same model, just obviously different amounts of cushioning. So they ran these participants, they ran them 5 trials per shoe condition toward 2 forced platforms and were instructed to land a specific foot on a forced plate. So interestingly, they didn't have them run on a treadmill. They just had them run forward, and 2 separate forced platforms a certain distance apart were used to capture some of these values. Visual 3D software was used to capture joint kinematics. Variables captured kinetics, so some of that force stuff, so average vertical loading rate, AVLR, vertical impact peak, and vertical active peak of the ground reaction force. As far as the kinematic kind of range of motion stuff, they measured eversion and dorsiflexion angles and eversion duration.
And then the results of this study they found that there had an increased AVLR in the minimalist shoe versus the traditional and maximal shoe, which could lead to increased injury with a rear foot strike pattern versus a forefoot strike pattern in the minimalist shoe. There's no difference between vertical impact peak and vertical active peak between all 3 shoes. They notice increased peak eversion in minimalist and maximal shoes versus traditional shoes. Increased duration and toe off of eversion duration and toe off in maximal shoes versus minimal and traditional. Decreased dorsiflexion in the minimal shoe versus the traditional and maximal shoes, and increased dorsiflexion excursion in the minimal shoe versus the traditional and maximal shoes. So then here, these just kind of summarize everything on the chart you see on the left. You can see x-axis is percent of stance phase, and then y-axis is mostly in the eversion. And as you can see from those curves, you can see the minimal and maximal shoes had the greater peak eversion than in the traditional shoe. And then the table on the right just kind of summarizes everything that I mentioned in the previous slide, and just kind of picked out the more relevant data. So, and then as far as discussion goes, I thought it was interesting. There was only about 20 people in the study, 6 male, 14 female. And as far as foot size, they only allowed people who wore a men's 10.5 or a women's size 8. So I feel like that was kind of limited, and somewhere they could go in future research is, varied foot size and see if that has any kind of effect. Obviously, there's only one shoe manufacturer, and it was the same shoe. All they changed was the basically the stack height on the shoe. So it'd be interesting to see how other shoe manufacturers would affect all those factors. They only looked at rear foot strikers as well, probably because with the rear foot striker you have that vertical, that distinct impact peak. And I know also in the study they had like people who transitioned to the minimalist shoe ended up switching to a 4-foot strike pattern. And I believe that they were excluded from the study after that.
Yeah.
So what would the data change with other foot strike patterns? And then, like I said, the other factors as far as with the shoe manufacturer, things like heel toe drop, heel width, shoe weight, midsole geometry, how all those can affect, your foot kinematics as well as the impact peaks. And then, looking at other things like foot structure, other running athletic populations just outside of runners, and any variables up the chain. So I just wanted to open up for kind of a discussion, what you guys kind of think about any of the points that we've kind of found interesting, or if there's anything you guys noticed reading the article.
Do you guys think this kind of goes along with what we've learned about changes or differences in shoe wear, or is kind of contrary to what you previously understood about and how it affects mechanics? Does it impact the way you practice at all?
I thought it kind of like everything we've learned so far, as far as like shoe type and foot patterns, well, strike patterns. I thought it was pretty interesting that there was only 3 runners out of the 20 that switched to the 4-foot strike pattern. I figured there'd be a
Yeah.
higher rate of runners who would go from rear foot to 4-foot, switching from like the traditional maximal to the minimal shoe. I found that kind of interesting. I was expecting a higher percentage instead of just the
Yeah,
3 runners.
I also found that very interesting. Again, intuitively, you would think that like, oh, if they're running in a maximal shoe, they're always going to be a rear foot striker, and then if you switch to more of a minimalist shoe, and can't necessarily rely on that cushioning, then you're going to have to take a decreased step length and adopt more of a 4-foot strike pattern. But yeah, interestingly enough, not these. Yeah, what they found is that they didn't these since all of them were rear foot strikers in the beginning, not really a ton changed. They still adopted the same running mechanics, and whether that's because the study was too short in duration is something to consider. So obviously some limitations there, but yeah, I agree with Tobias. I was also kind of thinking that more people would adopt a 4-foot strike pattern. But does anyone else have any thoughts about that?
Wait, you said like during the trials, they had 5 trials. They only ran like a short bout. It wasn't like a longer distance.
No, I don't believe. Yeah, they
Basically just over a force plate.
yeah, basically pretty much over a force plate. So I'm not entirely sure, but I'd imagine that they started them far out. They didn't start the force plate wasn't right in front of them when they started, but so I'd imagine that they had them, I don't know, like at least 20 yards behind the initial force plate to get your typical landing pattern, so that it's not just like when they're starting out running. The goal was to collect the data after they had transitioned to the more of the running mechanics. But yeah, I thought that was interesting that they didn't use a treadmill or anything like that, but force plates.
Do you think that maybe like if one way they could go like in the future is kind of see how it would affect like in the long run? So having somebody, run, I don't know, however many miles that maybe they're used to, and then kind of taking the data just to see how that would compare to the data from this study. Do you think it would change at all?
Me personally, I think it would change. I think you would have more of the 4-foot strike pattern going on because if they're only doing like the 5 short bouts, it's not going to be enough time to adapt and change their pattern. As far as like the loading that they're taking through their heels, most likely, so they won't really have the stimulus enough to want to have them change and adapt to a 4-foot pattern. So I think a lot of other things could probably change if they actually ran a longer distance. Let's say like even though like 5 minutes straight, I think there'd be a difference.
Yeah,
It's like the short stop and restart.
I agree. Does anyone else have any other thoughts about that? Kind of a different direction here, but with what we've learned about shoe prescription and understanding how the design and architecture of the shoe or the stack height, how it affects or doesn't affect running mechanics, do you guys see yourself educating patients on that, or do you feel like it just doesn't make a difference and there's no point in addressing it? You know, is it something that you consider shoe prescription and what they're running, or do you have an opinion on it, or is it more so like, so whatever they're comfortable in, let's address their deficits, not worry about the shoe? What do you guys think about that?
In my first clinical, my CI did a lot of running evals, and he did a lot of foot prescription, like Hoka's and stuff. And the patients that I saw found it beneficial. But he had like a lot of knowledge about, like like studied it a lot and like knew more than I did. So I feel like if I were to implement it, I would have to learn more about it because I don't feel that I would be like competent enough right now to prescribe a certain footwear to somebody.
And I feel like too, that's kind of where you want to find somebody who's an expert in that kind of stuff. Like I know, like at my next clinical, I know there's like a CRC right next door. So like kind of networking with, professionals and things kind of in that respect, and kind of just absorbing knowledge from them, as well as kind of like deferring to them as well, I think would also be beneficial.
Yeah, going off of that, there's actually in Akron, there's like a place 5 minutes where I live in. It's a shoe store where they're like experts in like footwear and stuff, and they custom make shoes. So I think I would send my patients to them so that they could further like prescribe them shoes.
Does anyone else have any other thoughts about shoe prescription, or if it's relevant to you?
Sticking with the shoe prescription, I think it also depends on if like the injury that they have, if it's being caused by the shoes that they're wearing, or it's just a kinematic contribution just from the way they run. So it's kind of almost like what came first, the chicken or the egg scenario. I think it depends on like also like how long that person's been wearing the shoe. Like if it's a new model that they've been testing out and then they got injured,
Yeah.
then you want to start looking more at shoe prescription. But if it's something like they've been wearing this shoe for same model for, I don't know, a couple years now, and it's just something that's just happened recently, do you want them to start looking more at the mechanics of their running more so, or like their weaknesses in their lower extremity and things like that before you start looking at the shoe?
That's a good point.
I'd agree with Demias with that. I feel like it kind of goes similar to what James was saying earlier with like orthotics, like try to address their like muscular kind of deficits first. And then if you're still not solving the issue, then maybe kind of go into shoe prescription.
Or kind of like a last resort type of thing.
Yeah, I think it's also relevant to note, about the foot posture index. In theory, it makes a lot of sense to want to look at that, but it's kind of interesting whether or not it's, because you can't obviously change it. So not something you would necessarily do for every single running patient that comes into the clinic. But maybe just kind of a mental note, like, okay, they tend to be more pronated upon landing. But nothing to, I think it goes with anything, is that to never fully be like any sort of purist and just like, oh, it's always foot posture or it's always the shoe, but to kind of have an open mindset about that. And I think that's my biggest takeaway from this study, is that, again, going in, I would think, oh, everyone's gonna adopt a different strike pattern when switching from maximalist to minimalist. But if anything, this study showed that it's not necessarily going to change. I know it had its limitations, but to not put too much stock into the stack height or the type of shoe they're wearing. But yeah, does anyone have any other thoughts or takeaways from the article? Alrighty, well, thank you for tuning in to the article discussion of the century. I hope it was well worth it. This is me and Jay Dizzle signing off. See you guys. Ready.